watching Let's Chat.
Glad to have you back with us as we continue on Let's Chat. Dr. Rob Headrick is joining us here this morning. We're talking about some of the issues concerning getting lung care out to patients, health care out to patients, instead of patients having to go get the health care themselves. Kind of a radical step there, Dr. Rob Headrick.
It is. Health care is difficult, and certainly when you don't feel good, or even particularly when I'm asking somebody to come in for a screening exam,
Right.
Nobody wants to take extra time off from their busy life,
Sure.
particularly to go to a doctor. It's
Sure.
inconvenient. You'd rather fish, you'd rather play golf, you'd rather do something more
Most
fun.
people would do just about anything as opposed to going to see a doctor, especially for something as significant, potentially life-changing as lung screening.
Well, it's frightening. Nobody wants to hear sad news or that
Sure.
there's a problem. The challenge is everything from about here to here in your body you can't feel.
Right.
So the assumption of I don't feel okay, I'm doing all right, I must be okay is not correct. We have a sore throat, we know we need to go to the doctor.
Right.
We've got strep throat. You can't walk on your leg, you know, to go get an x-ray.
Sure.
We just assume if we feel okay that you're all right.
And that is not the case.
It's not. Not for a segment of the population. When we get over the age of 50, one of the two most likely causes of early death are going to be heart disease or lung cancer. And one of the things we're trying to get individuals over the age of 50 who have a family history of cancer, who have a smoking history, to get their lungs screened.
And now you are making it easier than ever before, and that's part of the reason why we enjoy talking to you about this. I mean, it's not like you have to make an appointment 6 months out, sit in waiting rooms for 3 or 4 hours, and then finally get around to getting your results 2 weeks after the test.
Right, that's traumatic. That's just throwing salt in the wound.
Sure.
Idea is to make it easy, and one of the pilot projects we started here was building a mobile CT scan platform that actually can get out into the communities. What we're now working with is Governor Lee and our Congressman Fleshman and Senator Alexander and Blackburn to actually expand that throughout the whole state and the region, North Georgia, North Alabama, to where we're coming to where the patients are, making it quick and easy, and particularly an ability to get immediate feedback as to what's going on inside your body. It's kind of like lifting the hood of the car up and being able to see how you're aging.
That's pretty phenomenal to be able to have the test done and to get the results back that quick.
Yeah, but it's an educational opportunity of truly looking at how you're wearing out the parts in your body, what things are likely might be around the corner that would be certainly difficult, potentially life-ending that you can maybe prevent.
Sure.
Whole different concept of health. Instead of being the fireman always trying to put out a fire, we actually want to get there and try to not let the fire happen to begin with.
Any idea of how many patients your mobile lab has seen to date? Just a rough idea?
We're over 1,000.
Right.
And this was just a test. Could you build the technology? We're celebrating the 50th anniversary of going to the moon.
Sure.
So I go, this can't be that hard. But there are technical challenges. We're able to create a efficient and mobile platform where it would work and could actually be driven out to the public. And then with our partnerships with EPB and others, getting information directly back to the hospitals and directly to the patients.
Right.
Made that a doable process. We now want to expand it across the whole state.
Pretty phenomenal work that you were doing, Dr. Rob Headrick at CHI Memorial. Just can't thank you enough for coming down and spending some time with us.
You're welcome.
You can find out more about Dr. Headrick and the great work they're doing with the Mobile Lung Lab at mylungcare.org, mylungcare.org. Stay with us. We are back with more after this.